You're live.
All right, it's 6:30. We're gonna call the meeting to order. 2.0 prayer, Mr. Whalen. All right.
Let's pray. Lord God Almighty, thank you for this opportunity to come before you and to serve the people of Stephenson County, the people of that work and live at the Stephenson Nursing Center. Pray you would help us discuss things in a amicable and respectful way. And to make good decisions, Lord. I pray that you would help us to be wise about the things that we need to decide upon tonight. So please help us. I ask that in Jesus' name. Amen.
Thank you. 3.0 approval of tonight's agenda. Do I have a motion to approve?
So moved.
By Mr. Whalen, do I have a second?
Second.
By Mr. Hadley, any discussion? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. 4.0 review and approval of meeting minutes from July 10th meeting. Do I have a motion to approve?
So moved.
By Mr. Whalen, do I have a second?
Second.
By Mr. Hadley, any discussion on the meeting minutes? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carried. Approval of claims totaling in the amount of cash requirements and manuals to $364,584.28. Do I have a motion to approve?
Motion to approve.
By Mr. Hadley, do I have a second?
Second.
By Mr. Whalen, any discussion on claims? Seeing none, all those in favor say aye. Opposed? One opposed. All right, 6.0 public comment. Do I have any public comments? Anybody? Just come on up. You have 3 minutes. Same thing, state your name. There you go. Hold on 1 second.
Hi, can I start?
Okay,
Yeah, you all know I'm at the Pines. And I have sent plenty of letters out. I'm sure you all know where I stand as far as wanting to keep the nursing home in the public's hands. I know that there's some things on the agenda tonight and that are pretty upsetting as far as problems with fines and this is, to me, there has been an issue as a taxpayer with not really using our funds properly. We have a beautiful facility, and unless we are managing it to the point where it is sustaining itself, we are losing value, which is losing my money, your money, everything's money. And you know that this, I've mentioned it, and I know you're aware that this board has made several statements that you are not capable of managing this nursing home without a management company. And that's why you went up, hired a management company. And that actually went pretty well to start with for 22 and 23. And in 23, things went south. I mean, they really did. And unfortunately, a wonderful administrator we had, Shannon Harris, unfortunately quit. And I think at that point, if you go back and actually listen to the minutes, you can see that the cooperation with TCM was not what it was in the beginning. Now, I'm not pointing any fingers, but I just know that if we had a management company when our former administrator told us that he could take care of things and it was miserable. I mean, it's just been terrible since January. And you know, who knew that? I certainly didn't expect that. I was impressed with him, but there's no backup when you don't have a management company, when you don't have that person that's actually taking care of all those little odds and ends. They would have known that the cost report wasn't done. They would have known that, you know, if the CMS wasn't happy for some reason, when those tags came in, they would have taken care of them immediately. Instead, we are going to pay very possibly huge fines. And there is a problem, that's management. And that management comes back to this committee and our county board. So I really wish you have a different attitude moving forward and realize that selling it is not the solution that the taxpayers want. And that managing it properly and letting it grow and become more, it started in 1852. That's how long this has been here. And in 1852, I'm sure the people that decided they needed to do something were a little nervous. Oh, how's this going to work? Are we going to get enough money to do it? What are we going to do? And that's the same situation you're in. How do you do it? Well, you make the best decisions you can at the time. Thank you.
thank you. Anybody else?
I'll say something.
Oh,
I'm Monica. I am the infection control wound care nurse at Stephenson Nursing Center. Our name has not been validated for some time. I'm asking that this committee please vote unanimously to move forward with the sale as soon as possible. To think that there's time to take it back to the community would be a huge injustice to the residents and staff who are there today. We do not have the financial ability to stay open for probably even another month, let alone for however long that process would take. Our only salvation at this point is Serenity Estates, unless someone in this room is willing to give the nursing home $2 million. Serenity Estates is making it possible for our residents to stay in their home with the same caregivers. Someone at last meeting said we need to think about the future and the long-term aspect of keeping it a county facility. That is not an option. The financial crisis is that we do something now or we close the doors, and that is the last thing that I want to see. I'm asking that you put your differences aside and open your eyes to the reality of the situation. If you truly care for the residents and staff, you'll put your politics aside and vote to do the sale and as soon as possible. Thanks.
thank you. Anybody else? All right, moving on. 7.0 reports to the committee. First up, I would like to introduce Scott. He is the new interim administrator. And then, so if you want to introduce yourself to the committee and.
Sure. My name is Scott Hockstead. I've been in long-term care for about 23 years. Mostly for the last 10 years or so in more of a multi-site operational role. So I've been vice president of operations, regional clinical operations for some larger regional companies throughout the Midwest. Decided to back off from that due to just my father being diagnosed with Alzheimer's last year and my travel last assignments all over the country constantly. And I'm excited to be here. It's a wonderful community and the residents are fantastic. The staff have been great. And I'm just glad to have this option to do this.
Okay, anybody have any questions for Scott or anything before we move on to the report?
Thanks for doing it.
Yeah, thank you.
Very met.
Yes.
So I'll let you know, Tim.
Tim Whalen, I've been on the board since 2022, December, I believe, and the finance chair for the finance committee and stuff. So that's kind of my big goal, but try and support her efforts on this committee as much as I can.
Check with Denise.
Nice to be here.
And then we have Ronnie Bush that's absent, could potentially show up. Legal side. So, all right, so 7.1 is the administrator report. So if you want to kind of go through the census and everything. And I think you have everybody else's reports as well too. I'm gonna prepare to help
I
us.
have, yeah.
Okay. Well, I'm assuming I'm going in order of what's in here.
Okay.
Oh, cool. Perfect. Well, I'm gonna assume the safety committee because I do not have a safety committee report, so I'm just going to maintenance. I believe you have those reports in front of you. Really, we had inspection that was done, no deficiencies found on 7/28. Kind of went through our generator weekly and monthly tests, which is good. No deficiencies found there. Monthly fire drill was completed on 7/29. Annual fire alarm inspection was completed on July 17th and 18th. Utility report. Do you guys need me to read through all this or no?
No.
Okay, all right. Yeah, and there's nothing else at this time.
But we have a gentleman.
Yeah. Yeah, those. Kind of going through HR really quickly, open positions. We have 3 full-time CNA openings, 1 part-time CNA, full-time RN LPN, 1 part-time CNA for a PM shift, and then 2 full and 1 part-time CNA for day shift. The admissions individuals, marketing director, she did resign. She's retiring. Last day would be the 29th of August. So that position's open. And then our MDS coordinator did step down into a floor nurse position. So that leaves that position open. Applications, mostly through Indeed. We are also doing things, again, through word of mouth and walk-ins. We had a lot of applicants the month of July. We had a receptionist opening, so that brought in a ton of applications. CNA applicants we received, 2 of them were not eligible for rehire, 6 of them didn't show up for interviews or unresponsive to interview requests. We did have orientation this past week. We had 2 CNAs that were in orientation, 1 full-time PMs, 1 part-time every other weekend on knock shift. They have been going through their orientation, which is fantastic. July, we had 4 terminations, 2 new hires, and we did complete PBJ. That was submitted last week.
I have a question. On emissions and marketing director, you said the 29th is her last day,
August 29th, yes.
August 29th. Isn't that the one that we did bonus thing for?
So Jeannie's leaving?
Correct.
How long was she with us?
October was like.
Yeah. I think it was about 2 years.
Any reason why she left?
She's retiring.
Retiring.
Yeah.
Oh,
Her and her
okay.
husband are planning on traveling the world, so
Okay, thank you.
you're very welcome. Moving on. Activity, you have the monthly calendars, I believe, so there's not too much to report there outside of day-to-day activity programming. And then I'll go to, oh, great, there you go. Yeah. And then we'll end with marketing and admissions after business office. There you go.
So, the Medicaid pending report, so there is 16 that are current, there's a breakdown, there's the 7 that are redeterminations. For Medicaid benefits, I'm constantly working with Medicaid with those, and the family members on the ones that I need information from. 4 currently, that are working with family for the Medicaid application and or have already submitted that or am, requested more information from Medicaid to submit. And then we have 4 applicants that have been submitted prior to, and we're waiting for the approval or denial notice for those. One of them that actually has Medicaid, but we're just waiting for them to, admit them in the facility. As far as from the last month, one of them was approval, resident shared concerns, it's just the one. No private pay concerns, we only have the 1 private pay. Insurance, there's not really any updates on those. Excuse me, for the trust accounts, there's not been any issues, constantly working with updating those accounts as well. Insurance authorizations, those to believe to be all uploaded from the month of July. For billing and claims, just still continuously working with quality with those. Obviously, you guys know that the accounts payable, the August claim that was delivered to the treasurer's office on the 23rd and the amount of $309,640.47. And then the Medicaid rate remains at the $315.47 for the month of the quarter of July.
Does anybody have any questions on the administrator report? Yes, sir.
One of the significant things to me that I see here, I'm looking at the matrix care report, which I'm getting a little ahead of myself, and it ties in what you're talking about. The significant amount of revenue that's outstanding is listed on the private line, $703,000, right? And I assume most of that is because of Medicaid pending situations. And I think it goes to the overall issue. Part of this is, you know, a private company that has multi-sites and things like that has the capital to float that a little bit longer than what position we've been in for some time. But how long, do you have any kind of estimate on how long people stay on Medicaid pending before we're paid back? Because the other big line on this revenue side is Medicaid, 329 outstanding. And
Right.
most of that looks pretty clean, you know, prior to the 90 days. So, but I'm just curious. If you have any idea?
I mean, as far as with Medicaid and, I mean, just for one example, I can tell you, one resident, had applied for Medicaid prior to coming to the facility, and that was in January, and that application is still not approved. It's still currently pending. Right. So, I mean, that's,
We're paying for all the services for that resident, but yet we're not receiving any income.
not from Medicaid, no. No.
Well, from anywhere. I mean, we're not getting privately paid, are we?
Well, so it wouldn't fall underneath privately, but you would be getting the resident share amount. So whatever their income is. you
So
would
if
be
they
getting-
have like social security coming in, I just want everybody here to understand
Mhm.
how that works.
Right, so it just depends. I mean, it's social security typically. Sometimes it's social security if they have a pension also. So it would be any of their income minus their allowance,
Just for $30 now.
60.
Oh, it's up to 60.
So, yeah, the monthly allowance is 60 and any minus any insurance premiums that they may have, like any of those would be, so all of that would be considered resident share.
But just for the committee's benefit, I mean, that's the lion's share of the outstanding revenue. And I
Right.
think it has been for some time. Even that, even management companies. Okay, thank you.
Okay, so I'd like to back up one thing, because you did mention PBJs. Would you be able to inform the committee on the Q2?
Sure.
PBJs?
So, those questions about, any effects on, the second quarter not being submitted. Basically two things. One is, that it would, affect our 5-star rating for staffing, which is already posted on nursing home compare. So it does indicate that there wasn't data submission for that. So that automatically puts you at a 1-star for staffing. The other thing, part of it is Illinois, the state of Illinois has minimum staffing requirements. Illinois Department of Public Health, it's kind of interesting how they do this. So they take PBJ data and then our census data by quarter, but they're always 3 quarters behind, 2 to 3 quarters behind, and you have to submit that information. And basically what they do, the way staffing is broken up in Illinois is it's based on they call skilled and intermediate care. So any of your residents in your facility that's receiving skilled services, or if you have Medicaid residents that are, let's say, receiving skilled services, the skilled services could be anything from long-term use of like a feeding tube to let's say they're on a trach or something like that, or receiving wound care, even if they're long-term, that will kind of bump them to that skilled setting. So we have to supply census, break it down by intermediate and skilled. And then what the state of Illinois does is they take that data by PBJ and they then look at it, they're gonna find the community based on their staffing regulations and what our occupancy was at that time. And what they do is they take what they determine is the average wage for each position. So what they're determining is the average wage for RN, LPN, CNA, and then they determine based on that if there'll be any fines levied. So we're not set yet for the next submission of that. I think that's probably, if I remember correctly, not until October. So that would be the next time that we have to submit that out to that. So there might be some negative effects of that PUJ data based on that. But we don't know for quite a while, because after we submit it, it takes usually another 30 to 60 days for them to analyze and get back to each provider as to whether or not the fines issued.
Okay. Any additional questions?
Always.
7.2 matrix reports. Is that you want to come in?
I can, I mean, I know everyone has a copy of it. I actually wound up, usually they do send it to the administrator and myself, but I wound up having to get it, so I haven't looked over it myself into too much detail yet. But you have the overview on the first page for 2025. For the charges, so the charges and the receipts, and then you have the next page is the current aging report. So you'll have from June to November, and then the current outstanding balances. On the next page, you just have the AR cleanup overview. They have the breakdown from January through, this is for 2024, from January to December. And then all the different categories for that report. And then they have the AR cleanup, which is the progress to date report that has a little bit more details on here for the write-offs, credit balances, and things of that nature. They're pretty detailed on the reporting, so that's always at least for the breakdown aspect. And then you have the summary of the AR activity for 2025 for July. And their totals there for that, and then just their notes and the follow-ups on the bottom of the back sheet. Still needing some access to two portals that I do not have access to. And I mean, I haven't had a whole lot of time to spend on those two. I know some of them we can get through, remits through the county, the health department. But other than that, I don't have access to those either. So I mean, that's pretty much it, unless anybody has any questions on part of the report, I can try to answer them. If not, I can try to get with the quality and get an answer and get back to you.
No, I appreciate all the detail on it, so.
Yeah, they do a good job on that.
Any additional questions? Yes, Chairman.
I'd like Georgia to briefly go over information that we just received, I think, yesterday regarding Matrix.
Yes, so you two, Scott and Carolyn. I know they've been working a lot on this past couple days, as have I. We were notified that Matrix, the software portion that does the daily software that has the medical charts,
All the data
all of
entry
the data
side.
entry side of it, not the billing side, has threatened to terminate service as of tomorrow if they don't get payment in full.
Which is how much?
58,000.
That's just.
The
That's just what
one
they-
month, I guess
Yeah.
I should say, 1 month's
54.
billing, not payment in full, everything. As soon as I was notified, and I know Scott was working on it as well, I reached out and I was like, that, like, doesn't even allow us enough time to post an emergency meeting to rectify this, because we would need to have an emergency meeting
Right.
for an expense of that size. I was getting nowhere. Scott reached out, got a couple of contacts. I got some contacts through Christy, who was through the Matrix Billing Healthcare, Quality Healthcare, that spoke at the January board meeting, because they were unaware. And they wanted to keep billing and were being told, this may get cut off. I reached out to them. She provided both of us with phone numbers of upper management level people. Scott has communicated with them today. I have called at least 3 or 4 times today. Missed one of the calls while I was in another meeting, emailed back. We have been playing phone tag. We are hoping, and I know Scott made a plea with them this afternoon, that would be very detrimental if that service got cut, because all of the medical records and all of the charting and all of the things that they need to care for the residents is in that software. Sounds like he had made some progress, kind of explaining where we're at with proposed sale coming before the board next week, that, we would have more information forthcoming after that. But we have not gotten that confirmation as of yet.
Yeah, I had my conversation this morning. They still haven't got a response. I did reach out this afternoon, did get an answer. I did follow up with an email. I wanted to kind of create a paper trail as well. We were hoping at least to push that off at the very least to next Friday. But I haven't finished back as of yet.
And we were trying up till
So
then.
we're gonna find out tomorrow morning, when we're at the end of that. All right.
So this is the billing company that we hired in January.
So Matrix is the software that is used by all of the staff, whether it's admissions, nursing, dietary, all of the information goes into the Matrix software.
Okay,
The Matrix billing that was approved in January is a subcontract with Quality Healthcare through Matrix to perform the billing portion of it.
well, the billing company, I got a question on that. Have we paid them anything yet?
No.
And how much do we owe them, the billing company?
Yeah,
Because I have not seen it on the treasurer's report, or I can't find it on her report.
It's on there, I think. I'm
Under-
trying to locate it here.
Listed in the ratio. Karen, this is just the one from the billing. Is one which, okay, understand. So, because this one is.
I was just saying.
Yeah.
Oh, it's in. This is the.
Yeah, well.
The other piece to remember with Matrix is that, oh, sorry.
As of 8/8, we still owe them $143,350.
Their statement looks to be a little bit different than that.
And that was what, the treasurer sent out on the
On that long sheet of paper that we
Yeah.
get, what's it listed under? I was trying to look.
Matrix Care.
Is it Matrix Care?
Matrix Care.
And what's the other one listed
So
under?
that's combined. That's the whole, that
That's what
Matrix
it's called.
Care is.
So that would be the software plus.
Yes.
That's how I get confused now.
Mhm.
So I wonder if we can break that down, but but what do we have not paid them, the billing company, since we hired them. And we owe them what right now, roughly?
Well, it's over 100,000.
Yeah, okay.
Well, we owe food service 371,000.
Yeah, I know that.
Staffing, 200.
Not to get off topic with that, but payroll was $3,400 short. Revenue coming in was short by $3,400 to make payroll. So in order to make payroll for tomorrow, instead of repaying using the distribution that's given to the nursing home for the advance on the levy that we were forced to do to pay TCM, we're foregoing that payment back for this month for the repayment of that. So nursing has enough to cover payroll. But there's no more of that. With the distributions that are scheduled to come, what are remaining? You're gonna need every penny of it to repay that advance on the levy back to the general fund for the other departments that are counting on that revenue that's already budgeted for their expenses. Which is relevant when we're talking about the billing.
Yep.
Okay, any more additional questions about Matrix? All right, moving on to 7.3, review of monthly revenue expense report. Again, this comes from Adrian. I just put it on there so that way everybody has access to it. 8.0 old business, 9.0 new business, so 9.1 review and approval of proposed FY 26 budget with the new administration changes. That's probably going to be coming next month. 9.2 approval of interim administrator addendum, Bobby Wade. Georgia will be talking about this.
So 9.2 and 9.3 are the, I guess, more ratification, but approval of the addendums to hire the 2 interim administrators since the last time we met. Spoke with Carl and he said we had the authority to do that because the board had approved the master contract. These are just kind of functions through that, but said it would be a great idea to run it through the committee and board just so it is ratified. Ms. Wade was interviewed by us and set to start, and literally within the 5-10 minutes of us ending the interview and us deciding, yeah, let's get her in here, me calling the recruiter back, she was offered a full-time position to start the next day and was going to withdraw. She negotiated a 2-week start date with them, and we had her from July 24th through August 8th. She did renew the facility license with the help of Chairman Helms, got that taken care of, and it is hanging out at the building. So that has been done. She also facilitated something that we'll be talking about a little bit later in the agenda that Mr. Hoxton finished up for us. So her, like I said, we had her from July 24th through August 8th. From what I saw in the staff that I've spoken to, they benefited from having her there while she was there. So
Do you need individual motions on both?
I was gonna say, okay, so
Approval for Bobby, do I have a motion to approve?
You do?
Mr. Whalen, do I have a second? By Ms. Jackie, any discussion? Seeing none, all those in favor say aye. Opposed, motion carries. Then 9.3, approval of interim administrators. Scott, I'm still not gonna pronounce your last name.
Hoxton, I can say it now.
Motion to approve.
Um,
All right, Thank you, Mr. Whalen. Do I have a second? Ms. Jackie, any discussion?
Yes. Some discussion. I'm saddened that, you know, that this wasn't communicated to, at least the committee. I didn't even know that, Ms. Wade was leaving and that we have a new person coming on, you know, it would have been nice for the committee. I knew that we were gonna have Mrs. Wade come on, but, and I didn't know that she was only gonna stay this long, and then we hired somebody else. I'm glad that we're filling the spots, but it would be nice if this committee would have known this ahead of time, you know, that, we had her till August 8th, and now we have this gentleman. So, next time I wish that we could have some better communication on this, you know, let the committee, at least the, committee know about this.
Okay, any other further discussion? All those in favor say aye. Opposed? Motion carries. 9.4, approval of clipboard staffing agency agreement.
So I will present this as well. The second weekend, approaching the second weekend that Miss Wade was overseeing the building. She got a hold of me. We had a call with the state's attorney. She was concerned because she did not think she was going to have CNA staff to man the facility over the weekend. Staffing agency that we were using, that we owe money to, was not responding. She had a working relationship with this clipboard agency. They were a little bit less expensive than the agency we were currently using. Mr. Larson did review the contract and again advised if it was for the safety of the residents that he could authorize her to approve it with the ratification of the committee and board. So that is before you for that. Mr. Hochstead has verified that they have had to use the agency.
Move to approve the intern or the clipboard staffing agency agreement.
All right, from Mr. Whalen, do I have a second? Second. Ms. Jackie, any discussion?
Yeah, so we used them, how many times so far?
Believe off the top of my head, I think we've filled about 6 shifts with them.
Okay, and they're out of what, Rockford, are they, or?
No, clipboard's a national.
Oh, okay, the facility was subject to the Rockford, Illinois hourly rate, oh, okay, then, so. Okay, thank you.
Okay, any further discussion? Seeing none, all those in favor say aye. Opposed? Motion carries. 9.5, approval of bad debt write-off totaling amount of $329,516.61.
I will be presenting this as well. So in the course of conversations with Matrix and the billing company, while there was no administrator at the building, Ms. Brown from Quality Healthcare Matrix Billing asked me if these had been approved yet because she wanted to get them off the books so that it was easier with their reporting. And I said, well, what write-offs are you talking about? The last ones that were presented to us were at the April committee and board meeting that were for the previous year. I was then informed that she had been sending monthly write-offs that just never quite made it to our attention to get on the agendas. So if you look at the attachment I sent for February, the amount was $13,690.73. For March, it was $68,538.31. For April, $127,885.09. May, $117,502, and June was $1,900.48. So she asked that we get these approved so that they can get them off the books with the training. So.
Move to approve write-offs in the amounts specified.
And Mr. Whalen, do I have a second? I'll second it. Any discussion?
I have concerns about this, and I like the, I like to lay this over for the simple reason is that on this is quite a big amount. I'm afraid that there might have been some duplicate write-offs, and that I'd like this company to make sure that comparing from TCM and them because that's a high number.
So I did question that when she gave me the amount. And Christy and I over the phone and Karen, I believe, was on the call as well, went through what was written off in April. And she verified that that was through the end of last year, and this is what we had pending for this year.
I seen something, some dates like in 23 and stuff like that, and, my concern is, and then, some dates in,
This is all from the last 2 years.
It's
and,
what they've worked through.
but then TCM was doing a lot of write-offs too, and that's what I'm concerned that there might be some duplicates, and did they compare TCM's write-offs to?
They were given all the information when they started, so.
Well, I rather see them go over it with a fine tooth comb. I won't support it.
If you look at their reports, Mr. Hadley, their AR cleanup overview, there's an awful lot of detail in that specific report. I respectfully asked, part of the problem with the amount is because we weren't receiving these in a timely manner from the previous administrator, who we know what happened there. He was not giving us information. So I don't believe that there should be any concern. They've done a very detailed job of going through all of this, all the AR that's outstanding, all the communication from TCM was given to them. And I would respectfully ask you to reconsider. Because I think this is something we should get off the books before we try and sell this place, which is my first thought.
I wish, could they be on the phone at the board meeting?
I can request it. I don't, with their availability is, but I can definitely request it.
Yeah, I'm gonna say no for the time being until I hear from them, and stuff like that, how they went about it. And I have some questions for them, so that's it. That's all.
Okay, we will for sure reach out. All right, any other further discussion? All those in favor say aye.
Aye.
Opposed?
No,
Okay. 6.0, discussion and approval of credit card usage for nursing.
What number did you say?
Oh, 9.6, sorry. 9.6, discussion and approval of credit card usage for the nursing.
Okay,
Something from her as well.
so attached to the agenda is the credit card usage policy that everyone who gets a card issued in their name signs and agrees to. Number 13, if you pay attention to, if I can draw your attention to that on page 2, it speaks to the county administrator or treasurer may cancel or revoke the privileges of a card at any time with written notice to the committee oversight chair. When I was out there doing morning meetings, we talked about credit card usage and being sure that everything was a necessity and with turnover in the administration and everything else. Discussions, and Mr. Hoxton is in agreement with this. What I would like to see happen, I guess it's my recommendation, that Mr. Hoxton collect the 2 remaining cards that are out there. There were 4 to start with. One was in Marcos's name, so that one obviously is no longer there. When our marketing and admissions person submitted her retirement, we collected her card as well. Our thought is they will be in Scott's possession, but not used without my authorization. That we're not trying to hinder anything.
This guy.
This guy.
Yes.
Not trying to hinder any, day-to-day functions out there, but having a little bit more oversight on what is getting put on the credit cards. So
there'll be 1 credit card for the nursing home, but you'll be
the 2
holding it.
cards that are still there won't be canceled. They'll just be in Mr. Hoxton's possession and not used without my authority.
Okay, and the 2 are under names or?
Seth Shelley, our maintenance person, and Brenda Rothschild, our activities director.
Okay, and they'll be under his possession. Okay, that's fine. Motion to approve.
Mr.
I'll
Hadley.
second.
Mr. Whalen, any discussion?
one thing just real quick. We kind of talked about this at the county board meeting previously, but this is a countywide credit card account. So the real purpose behind this is that bill has to be paid, or anybody in the county that has a credit card could be affected by this. So that's why we could get a control or a handle on exactly what's the usage and how it's going to be reimbursed, so other departments aren't necessarily affected, if that makes sense.
And, hotel reservations and expenses are currently charged for Mr. Hackstead, so.
All right, moving on to 9.7 Oh, all those in favor say aye. Opposed? Motion carried. 9.7 approval of payments to CMS for civil monetary bills.
Do you want me to start and then we Peg?
Whatever you need to do. I can go through it, I don't mind.
I was gonna say this. When I said there was something that Miss Wade started for us before she left, it handed off to Mr. Hackstead, who submitted it earlier today, I believe. We were notified of the fines that are attached there from CMS. Ms. Wade approached me about filing for financial hardship. She worked on getting most of the paperwork together. There was a few things that Scott has worked on since he took over that was submitted earlier today. There's been a few questions back and forth from CMS. In the event that they do not grant us the financial hardship, there is an approval that would be needed in order to get the 35% reduction in the fine. Did I miss something?
I'm just seeing.
Has everybody looked through it and understands why the fine has been levied?
Yes. But I have some questions, so. So there's one fine here, that, totals $34,440, the 35. If we don't get the hardship, and I don't think we're gonna get the hardship because I did some checking that, they usually go by the whole county financial picture, just not the nursing home picture, the way I understand it, so. So we might not be eligible for the hardship unless we have a financial issue at the county level as a whole, but. Who knows, maybe they might grant it, but if we do, what's the 35% we're gonna have to pay out of that then?
$22,386.
Pardon me?
$22,386.
Okay. Plus, there's another issue here. Did we figure out? We're gonna be denied payment, from, February 26th, to June 20th of all new, emissions that came in. Have we figured out what lost revenue we're gonna get, suffer from, all the new people that we brought in? If we, how many people have we brought in? Have we even looked at that number?
No, that I'm working on it currently. Since,
Okay,
I mean, I started a week ago tomorrow. And so, I am actually working on that right now.
so, we have to look at, the dates there, did we bring, between those dates, how many new people we brought in? That could go upwards of losing, I kind of did some average math and, going back and looking at, could be over $200,000 lost revenue just because of that,
Yeah, I'm guessing closer to 250.
So once you get that number, I sure would like to know that number, please. Thank you very much. So what do you want us to approve tonight on this? Anything, or just we're waiting to see if we're gonna get the hardship?
I don't know that you necessarily have to approve anything.
Okay,
You don't have to take county board action to approve the fine, if that's what we're gonna pay or whatever the amount is.
So we just be moving it on to the county board if we approve it at this committee.
Up to the entire amount, sure. It's going before the county board no matter what.
Right, so I would move to approve it and move it forward.
Second.
second,
Mr. Hadley, any discussion?
Yeah, when will we know that, how many days that they have to notify us about the hardship? What is the drop date that, they have to have the full amount of money with,
Interestingly, there is no date on that. I would assume, I'll be honest with you, in 23 years that I've been doing this, I've never done a hardship request. Simply because it's hard to do, as you openly expressed before. So generally speaking, my guess would be that we'd probably hear back within 7 to 14 days, maybe sooner. Because I've already been in contact with CMS within about 20 minutes of me sending it off. Asking for some additional information. So I would assume though that if it is denied, you'd have to go that pretty quickly to that. Generally speaking, you have usually 14 days from the date of receipt of the 2567 to pay the CMP, but because we're requesting the hardship, which we had 15 days from that letter, so the drop dead date for that is tomorrow, which is why I submitted it today, so that if there was any additional information, I'd have some time to gather that tomorrow to get to them. So I would suspect probably about 2 weeks.
Which is why I kind of put it on the agenda. In the case of it not getting approved, it would be at least passed through the board prior.
okay, thank you.
All those in favor say aye.
Aye.
Opposed? 9.8, approval of repayment plan for Omnicare.
Move to approve as presented.
To have a second, does anybody want to have any discussion on it?
I would ask, the only question I have on it, I mean, obviously, in the position we're in, that really have a lot of choice, but is there any stipulation in the repayment agreement that says if we sell the nursing home, we can pay this off in one chunk and eliminate the interest? Are you aware of that?
I'm not. No, it's an 8%.
Because that would be my one, I mean, if we get the money in a couple of weeks, I'd have to pay it off.
The biggest reason we had to accept this as is if we didn't, it was going to be cash on delivery.
Yeah, I mean, man,
So they would not supply any medicine prescribed or otherwise to any resident without being paid first.
I would just check that. I mean, if they're gonna charge us the interest, they're gonna charge us the interest.
We can follow up.
This will come before the board as well, so we should know before then.
That would be great. Thank you, Jen.
Thank you.
Did we try to negotiate the percentage or they just said you're gonna pay that percentage?
This is what they came to us with, was this percentage and this proposal. Honestly, it's it's your guys' discussion, but it sounded to be a pretty good deal at the time, because it was either something
What I,
I was gonna have to pay ahead of time.
considering the amount owed,
Mhm.
the fact that the monthly payment is being, that it is,
Right,
the company, from what I have been told from accounts payable and business office managers, they have been really trying to work with. Had kind of got to the point where a plan had to.
So the first payment, if I read this right, the payment and interest is 1,749.46 on the 18th.
Mhm.
Okay, so it's gonna be before the meeting, our board meeting, that we have to make the first payment, correct?
I believe that we could still have this adjusted. This is nothing that's been finalized. This is the proposal.
Well, okay, so they're not aware that we have to approve this.
No, they are.
Oh, okay, so I just noticed that that's before the board meeting. Okay.
All those in favor say aye.
Aye.
Motion's approved. All right, 1.0,
Like to eventually just
Yes.
give an update on where we are with the contract for purchase. It's been with our attorney, Bolsonelli, now for 2 weeks. The administrator and I had a conference call with the attorney last Friday. I'm working through that. In the meantime, Serenity Estates has offered understanding that if this is approved on the 21st and we're waiting for IDPH approval, there's going to be a lag between the time of approving sale and closing on sale. Serenity Estates has offered an option within contract to where On September first, operating under the county's license, they would operate the home, so they would be covering payroll. They would be covering any and every bill that comes in at September first going forward. We would not be paying for those. Their management, quote unquote, management fee would be the revenue that they generate from September first going forward. The previous AR, which was already in contract for purchase, which we discussed, there's no fee other than that. So they're basically operating until IDPH approves the license. So that understanding where payroll is, understanding where drug company is, matrix, all of that for the billing, that is a pretty good deal.
We would still receive the upfront payment in order to pay a lot of these folks,
Not until close.
not till close.
Correct.
But they're gonna operate in the meantime.
Correct. You have to get IDH approval before you close.
Gotcha, understood.
So IDPH, timing that they have, they are revamping their review process. So before it wasn't quite as long as it is now, but we've talked to IDPH about the process. Serenity Estates has been in contact through John. If you recall, he has a relationship with IDPH. They believe they can fast track it. They've looked at everything already. They're not seeing any issues. Of course, that could change.
Right.
Who knows? But that is an option to ensure the employees stay employed. They're getting paid and the vendors are being paid as of that date going forward. Now, that's all tied in with the contract.
Right.
That's not, they're becoming the manager of the facility.
There would still be outstanding bills we would have to pay upon close.
Everything that is outstanding prior to September first is our responsibility.
Gotcha.
So, given the attorney a drop dead date of the 19th, they have this to us so it can go out with the board packet. So everyone has 48 hours to review the contract. My understanding is even though we've had the contract and we talked about it last month, not one single board member has gone up to the administrator's office to review the contract. So I'm only bringing that up because somebody's might be saying, hey, why did I only get 2 days to review this? The gist of the contract is upstairs at the administrator's office. So that's where we're at.
So their fee from September first on is gonna be what again?
Just the revenue that they're collecting.
The revenue they're collecting.
Anything that's billed, revenue that comes in, Medicaid, Medicare, private pay, private pay. They're operating, they're doing the income and the expenses, and we already know it doesn't cash flow. So they're gonna be using a lot of their own money to pay the vendors.
Kind of like TCM, what they were gonna do, pay,
Not that
they,
this is part of the contract for purchase. This isn't a matching agreement.
yeah.
They're operating under the county's license until the sale is done.
TCM would have operated under the county license too, so,
All right,
Unfortunately, they didn't follow the RFQ.
yeah.
10.0 adjournment. I have a motion to approve.
So moved.
By Mr. Lynn, second by Jackie. Any discussion? No. All those in favor say aye. Aye. Opposed? Motion carries. Have a good evening, everyone.